Aerobika is an effective addition which helps meet clinicians' objectives and patients' desires. Aerobika is clinically proven to reduce exacerbations by 28% in 30 days. Aerobika is clinically proven to improve ventilation after 3 to 4 weeks use. Aerobika improves lung function by improving the FVC by 200 ml. Aerobika improves quality of life for patients with COPD with improvement in SGRQ by 64% and improvement in CAT by 62%. Aerobika offers unique benefits. As with Aerobika, pulses of resistance are created using exhaled breath. The resistance causes positive pressure to build up in the lungs, helping to hold the airways open. With the airways helped open, the mucus is given more time and space to help it move out of the smaller airways. At the same time, the pulses or oscillations create vibrations within the airways. These vibrations help to thin and shake loose mucus which may be too thick or sticky for the pressure alone to move. The vibrations also help free the cilia. The combination of oscillations, pressure and free cilia aid in moving the mucus into the central airways where it